Today, I want to speak a little bit about how you can tell through blood work whether or not an infection might be present. And there's a lot of sophistication there. There's a lot of things I'm going to simplify. But what do doctors look at in your blood to think maybe this person has an infection? First of all, they've got to suspect that you might have an infection. So you've complained of fevers, chills, muscle aches and pain, or you've got maybe a red foot or really severe abdominal pain, shortness of breath, cough, some kind of symptom that will trigger them to look for an infection. And they might do some testing looking for viruses and things like that, but I'm talking really about blood here. So in your blood, there are lots of different cells that circulate. One type of cell is called a white blood cell, and there are many different types of white blood cells. But white blood cells are a key component of your immune system. They are what produce antibodies. They are what will chase around pathogens like bacteria and eat them. So white blood cell count is one way to understand what's going on. So the number of white blood cell counts of white blood cells in your blood may increase when there's an infection. And that's an immune response to what's going on. So when someone says your white blood cell count is elevated, that could be consistent with infection, but it could be consistent with other things too. If you fall, if you have trauma, even if you're just stressed out, you may have a high white blood cell count. Or if you're on steroids, you might have a high white blood cell count. So it's not specific for infection, but it does give you some information. And in severe infections, your white blood cell count can be low. It can be abnormally low. So if your white blood cell count is abnormally low, abnormally high, that might be consistent with infection. And then you also look at the types of white blood cells, because there are certain types of white blood cells called neutrophils, and those increase in response to usually bacterial infections. So people might look at the neutrophil count in your blood to see. There are other things that they look at too, things called inflammatory markers, things like C-reactive protein or the sedimentation rate or the SED rate. These are levels of proteins that go up when your body is fighting inflammation. Again, not all infection, an autoimmune disorder would increase those as well. And there are even more sophisticated types of molecules like procalcitonin, or certain other molecules that go up and maybe are more specific and sensitive. So I think the important thing to know is when someone talks about a white blood cell count, think about it in the context of your symptoms. Is it consistent with infection? Are there other inflammatory markers that are elevated? And you can ask your doctor all of these questions when they're trying to tell you that you do or don't have an infection. You might ask about the white blood cell count and what else they know about the type of infection that you might have.